Millions of babies are missing out on life-saving vaccines as the coronavirus pandemic disrupts immunization campaigns around the world. The United Nations Children's Agency, UNICEF, has warned that it could lead to thousands of children dying every day from diseases that had been largely brought under control. Our global health correspondent, Tulip Mazumdar, reports.
New mums trying to do the best for their young babies in the midst of a pandemic. This clinic in Niger's capital, Niamey, is usually packed, but restrictions on movement, a shortage of healthcare workers, and the fear of catching COVID-19 have kept many families away. Health worker Ramatu Garba says far fewer women have been coming to get their babies vaccinated since the pandemic, and children are now at greater risk of other killer diseases like measles. Many countries were advised by health officials to suspend vaccination campaigns to avoid the spread of coronavirus, but now there's a stark warning about the longer-term impact of this disruption.
Measles is on the rise, diphtheria, cholera. So all of these issues are going to be a real problem. As a world, we had conquered in this past century many of these preventable diseases for children. And so we make great gains on childhood survival. And what is now threatened is all of those gains in the last 30 years, that we will wipe them away just because children are not getting immunizations.
The pandemic is disrupting life-saving vaccination campaigns on a global scale. In Southeast Asia, it's estimated more than 34 million babies missed out on their routine vaccinations. Both Nepal and Cambodia are currently reporting significant measles outbreaks. In Africa, it's estimated around 23 million babies missed out on their routine vaccinations. Ethiopia, for example, is currently fighting measles, cholera and yellow fever outbreaks. Recent research suggests disruption to these types of crucial services could result in the additional deaths of more than 6,000 children every day. Medical staff around the world are working tirelessly to try and ensure those devastating numbers don't come to pass. Here in Bangladesh, vaccination clinics are reopening under a new normal.
When you have a big effect on vaccines like this, it takes some time to rebuild some of the systems around it, and that's going to be important to make sure we can deliver routine vaccinations. But also, as we rapidly move towards having COVID vaccines available, these are the same systems we're going to use to be able to deliver those, as well as to look for further outbreaks.
Despite the challenges, the work continues. These medics going door to door here in Colombia, as world leaders meet virtually for the Global Vaccine Summit hosted by the UK to ensure that these life-saving campaigns can continue. Tulip Mazumdar, BBC News.